our hormones metabolize down different pathways. We have alpha and beta progesterone. We have 2, 4, and 16 hydroxy estrogen. They all do different things. We don't want to make a lot of 4 hydroxy estrogen because that's what actually increases our risk of cancer. And our estrogen will shunt down the 4 hydroxy pathway when we have increased visceral fat, meaning we're overweight.
Wow.
Stress are like if you have MTHFR, so if you don't methylate B vitamins correctly, or when you have a really bad gut dysbiosis, it changes how our body metabolizes our hormones.
Welcome to the Ancient Health Podcast, where East meets West in the world of medicine. I'm Dr. Chris Motley. Let's bridge the gap between ancient practices and cutting-edge medicine. Let's get started. So today, everybody, we're going to talk about all things endocrine. I have Dr. Cassie Smith here with me today, and she is a board-certified endocrinologist. She's a medical doctor that specializes in the endocrine system, thyroid, gut health, and her page is very, I'd say very detailed, but also very fun. And she talks about how, in a good simplistic way, she takes complicated things and puts it in a very digestible manner about the hormone system. It's a big thing today, and we're going to talk about women's health. We're going to talk about all the things. Dr. Cassie, thank you for joining me today.
Thanks for having me, Dr. Motley. I appreciate you being so nice about my page.
When you see when other practitioners just put things together, and then I look at mine, I go, I really got a lot of work to do. So anyway, I mean, that's how it is, Doc. But
I'm giving you some tricks, some tips.
That's right.
I just
found out too.
I have a great husband who does all the things,
I'm telling you,
I just ran here to the clinic and was like.
But in the story of our lives, though, it's really running after clinic. Like literally, I got done here and I was like rushing home to get here to do the podcast. And I mean, it's the story of the docs that really are in practice and doing their thing, and we're always on the go and always on the run. And I think that separates a lot of the practitioners, the ones who are in the trenches with individuals and helping them out, because I think that people take that information a little more to heart when they know that a person who's out there talking about health is in it. So I appreciate that about you. So this is going to be fun. Doc, we want to start off as we talk about the endocrine system and about women's health. It's a huge, important subject today. I want to hear the story of how you wanted to do what you do and what drove you to do it.
I think most of us are here, like you said, Dr. Motley, because usually we were sick ourselves, right? So that was me. So I grew up in, the middle of nowhere, Missouri, and there wasn't great healthcare. There wasn't great information about health. There wasn't even really great jobs. And even whenever I was really little, I used to always ask a lot of questions like, why do people get sick? Why, I would have so many questions. And so I always knew from when I was little, I wanted to do medicine because I had lots of questions about well, why does this person, get sick and have to go to the hospital all the time and this person doesn't? And, my dad was like, it just happens. And so I ended up in medicine because I wanted to help people and I had a lot of questions. But then interestingly, I don't know if you believe in fate or God or whatever you want to believe in, but I think that God made me, he's kind of a funny guy, made me very sick in medical school, right? So I'm in medical school and I'm trying, and by the way, I went to medical school, I took out loans, very expensive. And I'm like, I got to do well. And in the midst of medical school, I got Graves' disease. At first, I didn't know what was going on, but I thought I was dying. So for people who are listening that don't know, Graves is a hyperthyroid disorder. So a disorder where your thyroid overworks and you wake up with your heart beating and you're drenched in sweat and you're really hot and you have diarrhea and you start losing a ton of weight. So at first it's fun because you lose 25 pounds and you're like, this is great, I'm skinny. But then when you feel like you're in menopause and you're always anxious. So ended up super sick, had Graves, figured that out in the midst of medical school and was just told, oh, you need to take this medication, which was methimazole, which is pretty standard for Graves, but it made me so sick and I didn't like taking it. And so I had questions with is there something I can do with my diet? Is this why did this happen? And the answer I got from everyone was, it just happens, take the medicine. And I didn't really like that. I guess you could say maybe I'm a little stubborn. And so I was trying to figure out well, what else can I do? So I keep, now I'm in residency and then I developed Hashimoto. So my Graves went into remission, thank God, but then I
Mm-hmm.
developed the opposite side of, hypothyroidism. And so now I'm being told, oh, well, take this medicine and it's fine. And my questions are always like, can I do something with my diet? Is it something with my lifestyle? Is it just take this medicine? So then I
Mm.
ended up in an endocrinology fellowship because I didn't like that answer either. And what I think I want people to realize is I was really sick for 6 or 7 years. I went to an
Mm.
endocrinology fellowship to try to make myself better. And even
Mm.
after the highest training you can get in medical school in the United States, I got out of fellowship and went, really the only answer is just to take a medicine. And so I was
Wow.
telling people I don't feel well for years. I was telling my colleagues and everyone was like, you're fine. I mean, you look fine on paper, your labs look normal, everything is fine. And I knew something wasn't fine. And so then I kind of went down this functional medicine rabbit hole, learned about gut health, started healing my own gut. My
Mm-hmm.
Hashimoto's got better, went away, eventually went into remission. And so I think I got here because I really just struggled for years trying to find someone
Mm.
to listen to me and make me better. And there are millions of people out there that happens to every day. And it makes me really sad.
It definitely it does, and I love that you've had. I don't love that you had to go through the experience, but as you went through the experience and you had a heart for individuals that went through the same thing, uh, going into this though, do you feel like that energy, when we talk about believing in fate and God, that God brings those type of individuals that suffer the same type of issues to you? You feel like that they come to you, they're naturally attracted to you?
100%. I think that, there's lots of things that I've went through that I think it's almost comical at this point, right? But I also had issues with fertility. I had issues with PCOS, like pretty much any endocrine disorder you can have besides osteoporosis or diabetes, thank God, I have dealt with. So,
Oh.
so as I started to form modern endocrine, because I got out of the traditional healthcare space and I started to form this functional medicine clinic, my North Star has always been, I want to make a place that I wish was available 15 years ago when I didn't feel well. And I want to have a place where people can come and feel heard, seen, validated, and be taken seriously so that they can get better. And I think, without all the stuff that I went to, would I be here? Probably not. And I think it's interesting, I never really, I had no clue this would happen, right? I don't know. I say prayers every night that are like, let me see what I'm supposed to see. Let me do what is, supposed to be done. And
Yes.
here I am.
And I think that whenever you have those prayers about where the path leads you and like where am I supposed to go, but also I'm asking, I'm not saying I know this for a fact, but like that when you're going down a path, just trusting that it's going to end up the spot you believe you're needed the most. And when you did that, you see at a young age you've had this, like you had the hyperthyroidism, the Graves and such. Are you seeing that more and more that ladies are younger and younger having hormone issues and they struggle with it?
Oh my gosh, Dr. Motley, it's so bad. Like in
Mm.
the last 10 years, it's getting so much worse. And that's part of why I wrote my book too, because my question, I'm just such a very much like, I want to know why, which is
Mm.
frustrating when you are just supposed to live your life and trust God, right? But
Hmm.
in medicine, I'm always like, why? And so what I found is like over, really in 2020, like I really
Mm.
started to get 2020, 2021, like all these really sick girls, younger girls, PCOS, abnormal periods, crazy thyroid disease. And I'm like, why? Well, when you start researching it, your gut plays a huge role. So stress immediately and directly affects your gut by way of your vagus nerve. And when your gut is affected by stress, it increases your cortisol and your insulin, which both are going
Mm.
to drive issues with estrogen and progesterone. It's going to cause weight gain. It's going to affect your thyroid hormone conversion. It causes dysbiosis, which interestingly enough, Hashimoto's girls, we all have certain things that grow in our gut like Klebsiella and Pseudomonas,
Mm. Mm.
acne and cause us to gain weight and cause us to not metabolize our estrogen and progesterone correctly. So we have really painful periods. So it just
Mm.
all was like, duh, like how, why don't we know this as I was writing the book and putting this together? And so to be honest with you, I was like, I never want to write a book. It's terrible. And in my little venture over the last few years, I have this daily devotional that I read. And I was
Mhm.
really like trying to figure out in 2022, like, I feel like there's something I'm supposed to do for
Mhm.
just humanity. I
Yeah.
had my husband and I had had a couple of miscarriages, and we are like, maybe we're not going to be
Mm.
able to be parents. So, like, what I was just trying to figure out like, what is my role for humanity? And I had this daily devotional that I read. And one night I had this dream that I was supposed to write a book. And I thought that's really weird. And I woke up the next morning and it was like in my devotional talking about how God wanted me to be a storyteller. So
Oh,
that's how I
heavens.
ended up writing the book. And I hated it. I hated the whole process, but I did it. So now I feel like I did what I was supposed to do for all of humanity. I put everything I learned through my disease process, how your gut affects your thyroid and your estrogen and your progesterone and stress. I talked about stress and sleep and mood and how we talk to ourselves, all of these things, how it impacts your gut, how your gut impacts your hormones, and then how they all work together. I put it all in one giant book so I never have to write another one again.
I read the book, like it's laid out well, and the way that you do it is very, very, I would say, intentional. And you talked about having Klebsiella, like a bacteria in the gut. With the gut, eating foods, can you touch a bit about how the American diet, and especially a young lady's body or a lady's body, really can wreak havoc on their hormones, like that process?
Unfortunately, I was in the generation where when girls were teenagers and they had painful periods or irregular periods, which I now know was probably insulin resistance and the start of PCOS and my thyroid being out of balance, you got birth control. Like that's what we give girls, right? Oh, well, let's give them birth control because then they won't get pregnant and they won't get acne and their periods will be regular. But I have a whole section in the book dedicated to what birth control does to your stomach. It's not good. And so I think I, was just like a lot of these girls out there who, if you've been on birth control for 10, 20 years, you've suppressed your body's ability to make estrogen and progesterone naturally. And then you stop that suppression because you decide you want to have kids like I did at my early 30s. The problem is not only have you suppressed your body's ability to make estrogen and progesterone for 15 years, so your pituitary gland, the maker of all hormones, has been asleep, but if you've also been stressed and not sleeping well and not eating well and not exercising well, all these things start to add up, right? And you and I both know that medical school does not teach you how to be nice to yourself, right?
So the hours. Yes, keep going. Yes.
Well, and so also these kids, and I call them kids now, 20-year-olds and 30-year-olds, it's kind of like we live in a different world after COVID where everything is like we're dinging all the time on our phone and we have all these notifications everywhere. Everyone is just so chronically stressed and then not seeing the sun correctly. And then to your point, we're eating this standard American diet that doesn't have fiber. And keep in mind that fiber is how our good bacteria eat and grow and flourish. And by good bacteria, I mean the ones that help us metabolize our hormones correctly so that we can have normal cycles. If we're not eating fiber, those bacteria die. Like they literally have nothing to eat. And when we're eating ultra processed foods and sugar, foods with all this sugar or just all these carbohydrates, our bad bacteria, our Klebsiella, our Pseudomonas, strep and staph overgrow, candida, all these bacteria start eating and messing with our hormones. And then our estrogen and progesterone aren't metabolizing correctly. Our thyroid hormone can't convert correctly. Our insulin goes up. Insulin and estrogen, I don't know if you know this, are on a teeter-totter. So when your insulin goes up, it automatically decreases your body's ability to make estrogen. Same thing with progesterone and cortisol. So when your cortisol is high from stress, it makes your progesterone go down. This is why so many 20-year-old girls now have low progesterone and they have really painful periods and they have very tender breasts towards the end of their period because they have no progesterone spike at the end of their cycle in their luteal phase. So they get an imbalance and then they get all these terrible symptoms. And it's because they're stressed most of the time from their cortisol.
That is, I love the way you put it. I mean, it makes me understand this. So whenever you have heavy stress load, like in this day and age, you hit a bit about like with strep and Klebsiella and stress. So would it be easy to say that if a kid, a young lady, got strep throat really badly when they're younger or got sick and they were just treated with antibiotics, that in the future they could have problems with their cycles, basically?
Absolutely. Or let's talk about the other drug. So antibiotics, you pointed that out. Birth control is a big one. A lot of people now can just go buy acid blockers over the counter, Pepcid, Prilosec, all these that kills people's stomach. And a lot of young people eat these now, Tums. Like I have a lot of people who come in and they say in their 20s, oh, I eat Tums because I get heartburn all the time. And I'm like,
No.
so you can go get these medications that block acid in your stomach, but ultimately when you're blocking acid in your stomach, you're
Huh.
killing your body's ability to digest your food properly. And then when you're eating, your food isn't digesting in your stomach, it's going to your small bowel, and big particles of food bad bacteria can eat easier, and the good
Ah,
bacteria can't eat it, and so they starve and die. And so we just have so many ways that we are messing up our microbiome. Not to mention, I talk in the very beginning of the book about like depends on whether you're vaginally born or whether you're C-section, whether you were breastfed or whether you weren't, whether you took antibiotics in the first 3 years of life or you didn't. I mean, some people, their gut is a wreck before they're 5 and it's not even their fault. And then we start adding in the stress and the diet and everything else. And then we wonder why people have hormone issues.
oh, I mean, truly, we wonder why, but you see these signs that you and I could look at a patient and go, yes, this is definitely something that could lead to that. But what are some of the, like, people listening would want to know, not that we're blaming any type of food. So people out there, I
Right.
don't want you to think I'm bad mouthing certain foods, but what are some of the foods for a person who has a sensitive gut, who has some leaky gut, who has
Mhm.
that type of condition? Are there certain foods that you would say you see in your office that a lot of ladies have sensitivities to, that it would be good to not say totally get rid of it, but maybe avoid in a time of healing? Is there certain ones that you look at?
100%. And, in the book, in the second chapter, I am like, here's the 10 things you do. Number one, you
Hmm.
remove sugar. And that means all form of sugar. I think some people don't realize how much sugar they actually consume, and that includes what you drink. So
Mm,
unfortunately, we
mm,
have this culture where it's okay to go through Starbucks or Dutch Brothers or wherever and get whatever we want to drink in the morning, which I'm not bad mouthing. If you want to go get an espresso over ice with some almond milk, great. But I think there's a lot of people out there who go and just get these drinks because they've done it. And if they actually looked at how much sugar was in them, they would
hmm.
absolutely die. And so you've really got to, you've got to be your own advocate. You've got to look at labels. And I list in my book too, here are all the hidden sugars, because now they've gotten smart and they start making weird names for sugars, right? Or they try to make it sound
Oh,
oh, it's healthy. And all sugar is going to do the same thing to your gut. It's going to cause it to be inflamed, and it's going to cause your bad bacteria to grow and your good bacteria to die. So the first one is you just really need to take a solid, look at what we are eating, but also drinking. And we
hmm.
need to remove the sugar. The dirty cousin is this drink that Crumble Cookie came out with. And it's
The
like
dirty.
Red Bull and I got Red Bull and like Sprite or something, and like these it's like pineapple puree and some other puree. It has over 100, it's like 86 or 100 grams of sugar in like in one cup. And it's like this viral thing that
What?
kids are drinking now. Like they want this before school. And then we wonder why kids act like idiots at school and we think they have ADHD. They don't have ADHD. They're on a sugar high and then they're on a
Yes,
sugar crash. Like, there are drinks now that have it's crazy, but
that's
I saw that
crazy,
online and
man.
somebody was talking about, oh, this is the best drink ever. And I was like, that's more sugar than you should consume in like 3 days. And they're targeting kids with these ads. And I'm like,
That's
our poor kids don't have a chance. And not just Crumble, but it's anywhere like Slurpees
yes.
and gas stations. And, Starbucks is have this sugar or whatever. And it's just like people have no clue what they're doing to their blood sugar, their brain, their insulin, their guts. It's really sad. So before we even talk about food, we need to talk about what we're drinking. All these energy drinks people drink, what are you doing? And not to mention, what are you doing to your adrenal gland, but what are you doing to your gut? So I think the
Yeah.
first thing is really taking inventory of like, how are we consuming any sort of sugar? And then the second
Yes.
thing is, how much fiber are we eating? Because most people in
Mm,
America are getting very little fiber, right?
very little. Yes.
We need 35 grams a day for our good bacteria to live. And on
35 grams.
average, people get like 10 to 12.
Yes, I don't see anybody getting 35 grams. So you need an average of that. I heard in the hormone system that fiber is needed to combine with bile, and then it gives you a better bowel movement, right? And so you're finding that a lot of girls are getting constipated, like, and they're not pooping out because they're not getting enough fiber.
100%. You nailed it. So if you don't have fiber, fiber is what kind of helps our lymphatic system. I tell people is kind of like our drainage detox system. It's what's kind of floating around and taking all the toxins out of our body. And all of our hormones end up in our liver. So our estrogen, progesterone, everything gets kind of processed through our liver. And this is the part that most people don't understand about their hormones. And so ladies, listen up. Nobody ever explained this to me. And as soon as somebody did, I was like, okay, so our body, this is also why women's bodies change throughout their cycles. I mean, we're bloated sometimes, we're not. It's because of the way our hormones are shifting. But when you are done with your estrogen and your progesterone, once it's kind of circulated through your body and your body's utilized it, our hormones metabolize down different pathways. We have alpha and beta progesterone. We have 2, 4, and 16 hydroxy estrogen. They all do different things. We don't want to make a lot of 4 hydroxy estrogen because that's what actually increases our risk of cancer. And our estrogen will shunt down the 4 hydroxy pathway when we have increased visceral fat, meaning we're overweight.
Wow.
Stress, like if you have MTHFR, so if you don't methylate B vitamins correctly, or when you have a really bad gut dysbiosis, it changes how our body metabolizes our hormones. That's one thing. The second thing is once it's done metabolizing, it goes to our liver. To your point, bile helps package up estrogen. I tell people, think about your estrogen like being rolled up in saran wrap. And then it gets put in a little ball. And then with our bile, it gets pushed out through our liver. And so you have to have your bile has to be able to flow, which fiber helps with that. So does lymphatic drainage. So does hydration. And then we have this piece of estrogen and progesterone that are all, ready to be excreted in our body because we're done with it. They're now in a bad form. Like we don't need this hormone anymore. So it's all bubble wrapped up and it's out in our stool. So it's in our poop, in our stomach. If we're constipated, women, because we don't drink enough water, eat enough fiber, or our thyroid isn't working, or we're not moving, or we're stressed out, if our stool just sits there in our gut and our estrogen is all wrapped up with saran wrap, if we have too much bad bacteria, that bad bacteria can go and punch little holes in the wrapped up estrogen and progesterone because it's hungry and it's like, I want to eat anything. So it starts punching holes in our bad estrogen. And guess what? If it punches enough holes in our bowel, our poop is still sitting there in our gut because we're constipated, that estrogen and progesterone that's in a bad form that needs to leave our body starts leaving through the saran wrap, and it gets into our gut. And then here's the problem. If we have leaky gut, which a lot of people have leaky gut now, not only is it in our gut, it leaves our gut lining and now it's recirculating in our body. And then guess what? Our breasts get tender, and then then our uterus hurts really bad. And then when we bleed, we have really painful bleeding periods because we have too much bad circulating estrogen that didn't leave because we don't poop every day and we don't eat enough fiber. And so this is why if you have breast tenderness and you have really painful periods, a lot of times your progesterone is low when you look in the luteal phase or the back half of the cycle because stress and cortisol are high. And the way you fix that is DIM helps and Vioxx helps and flax seeds help. The way you fix it is to fix your stress and fix your constipation by eating fiber, period, full stop. Like that's how you fix it.
Okay, I am going to rewatch this because I love steps and you put it great about how that estrogen gets those little areas, those saran wraps, they leak out. With this, if the estrogen is floating around, it gets pushed back out because it's leaking out. With the tender breast and those symptoms, is that also why people can change in their mood because excess estrogens are floating around and it makes them more sensitive in their emotions?
100%. But also keep this in mind. When that's happening and we're stressed, that causes even more stress because our body's like, whoa, why is all this estrogen? And then it's going to cause us to lower our progesterone even more. And then what happens when our progesterone goes down? Our cortisol goes up. And what does progesterone do for women? It stabilizes our mood and it helps us sleep. So then now we've got these women who are moody and they're having these terrible symptoms and we have breast tenderness and women will tell you, I don't sleep very well during a certain phase of my cycle. Well, what happens, Dr. Motley, when we don't sleep well? We don't make growth hormone. And if we don't make growth hormone and we don't get good, deep REM sleep, what happens? We don't convert our T4 to T3, which makes our constipation worse. We also have higher cortisol. We also have higher insulin. So then the next day we're craving bad food. So then we're eating more things that cause our insulin to go up and make our gut dysbiosis even worse because we're not trying to eat fiber. We're trying to eat all this crap because we didn't sleep well and our hormones are out of balance. And so this is what I talk about in the book. It's just this revolving door that you don't ever get off of. And this is why women will tell you, and I was one of these women. I started, like, women will come to you. Now it's girls in their 20s. Like, it started kind of bad. And then now my period's almost worse every 2 or 3 months. It's because their hormone cycle is getting worse because it just keeps revolving and nobody tells them, hey, the first thing you should be asking these girls is, how often do you go to the bathroom? Like, we have to get you going poop every day, every single day.
Yeah.
If we have to use aloe, if we have to use motility agents, if we, maybe we need to look at your thyroid, but we definitely need to be talking to them about fiber and hydration and movement and stress. Because if you force someone to go to the bathroom with stimulants, that doesn't fix the problem long term, right?
Yes. So for hormones, even if a parent's looking at their daughter or at their kid, about the emotional relationships that a child or a kid or a girl has, is that really important for them to make sure that they're in a non-stressful relationship, whether girl or boys or anything like that, with friends and such?
100%. I have a whole chapter in the book about that, how relationships cause so much stress, whether they're positive or if they're negative, right? If they're positive, great. But like, we're talking about relationships between parent and child. We're talking about child to friend. We're talking about child to themselves, like how we talk to ourselves. All of these things can cause stress. And if they're poor, negative relationships, they can affect your vagus nerve and ultimately affect your cortisol. And then all these things will change your hormones, and then we wonder why people have infertility issues, and it's just really sad. And honestly, at my practice, this is one of the things we really work on. Like, I saw 3 girls today that are in their 20s that aren't having normal cycles, and we really focus with them on, like, I want you to give me a diary. Like, I want you to tell me how you feel all day long. We've got to find where you're having these stressful moments, what's causing it. We need to fix it. And we really work on sleep with them too. And then evacuating their bowels or not being constipated, hydration, and fiber. Like, these are the things, because I don't want to give a 20-year-old anything. Like, could you give them progesterone in the back half of their cycle? Sure. Will it mess with their ovulation? Maybe. Like, I don't want to do that. Can you give them, DIM and flax seeds and Vitex and all these supplements? Sure. But why do we not just want to fix the problem? Like, why do we not want to tell them, hey, this is the problem? The other rule that we have with these girls is you don't get to be on your phone past 8:00, period, full stop. Not on your phone. Because when they're on their phone scrolling through social media at night, what is that doing? They're comparing themselves to other people. And so honestly, we have so many patients. Like, I had a provider meeting yesterday. It was really cool because all my providers were like, we have so many people recently who have gotten pregnant and they cry and they're so happy because we didn't give them anything. We just helped them fix their luteal phase of their cycle, right? But nobody talks about these things. And I think it's because it's not sexy. It's because it's difficult. It's because you're going to have to spend some time explaining it. And then we're not mean about it, but we're like, hey, let us help you. So where in your life are you doing this? Like, what do we need to focus on? Do we need to first focus on getting rid of that one Alani in the morning and adding water? Like, it's a step-by-step process. You're not going to change your whole body, like your whole life overnight. But I think it's also important to have people, we need to be accountable for our own health too. When I was really sick, I take full blame for it. I wasn't sleeping well. I wasn't feeding my body good nutrition. I wasn't exercising. I was completely stressed. I take full accountability for all the things that were wrong. And then I had to make a plan and say, hey, I'm going to start doing these things. No matter what's going on, I'm going to go to bed at 9. And we just try to help people figure that out in this crazy world that we live in. But you have to start taking some accountability, and you have to start realizing that, hey, I got to put myself first and start doing a few of these things, because I don't think people realize how important these little things are to your overall health. And once you put it all together, man, it makes a lot of sense.
One thing I see a lot of is this feeling of low energy. Like you're doing everything right, but your body just doesn't feel as strong or resilient as it used to be. And many times, that's not just about hormones or stress. It can come down to how your cells are actually producing energy. Inside your cells are mitochondria, these little energy factories that power everything. Your movement, your focus, even how you recover day to day. That's why I've been using MitoCure from Timeline. It helps support your mitochondria by clearing out the old damaged ones so your cells can function more efficiently. For me, I noticed better energy and just feeling stronger in my body overall. Timeline's clinically proven formula is now available at a new lower price. MitoPure now starts at $79 when you go to timeline.com/Dr. Motley.
You know?
It does, and you're making so much sense. I'll say it's hard to like give up your phone at night. We understand like you did step by step. Is that why? I hope I can make the connection here. That if a girl like starts to see changes in their normal length, because it's like 28 days and such, can you explain that part? Because sometimes I'll have patients come in and they'll say, well, it was 31 days, it was 24, and they had that. Why is that fluctuation? I know there's hormones, but is there like a simple explanation why that keeps happening if they go longer or shorter and then they go back to normal again?
Well, so it's I like to tell people it's a balance between your estrogen and your progesterone. Everything with your hormones is a balance. It's a symphony. Not one hormone works in a silo, which is why there are so many people out there getting mismanaged or just not the optimal care that they're looking for. Because what's going on with your thyroid is also affecting your progesterone and your estrogen. And what's going on with your progesterone and estrogen is affecting your cortisol and insulin. And all of these are affecting your growth hormone, your sleep, your mood, and all of this is affecting your gut. And then, oh, by the way, what I'm eating and how I'm talking to myself and if I'm seeing the sun and if I'm moving and if I'm hydrating, all that's affecting my gut. So it's so much, everything is connected. But to answer your question, I think people that start having changes in their cycles, we really need to be thinking about, okay, well, was it one time? Because if it's one time, a lot of times that can just be stress related. It can be, medication related. Antibiotics can do it. People really bad. I mean, stress can as well. Or is it like, hey, my periods are slowly getting longer and longer and longer? And if that's the case, the thing I worry about is, oh my gosh, your estrogen and progesterone balance is getting really out of hand. And in younger girls, it's usually, we hear the word estrogen dominant, like, oh, I've been told I have plenty of estrogen. That means you have no progesterone. Progesterone is our calming hormone. Progesterone is the hormone that makes us sleep well. Progesterone is the hormone that's going to allow you to carry a baby. And so the other crazy thing that I see, Dr. Motley, is all these young girls in their 20s that even in their luteal phase, their progesterone's like 3, 4. I mean, it should be in the teens. And so if these girls, God forbid, get pregnant, guess what? They have miscarriages. Because if you don't know that and you're not watching that and you don't give them progesterone immediately, they're miscarrying because they don't have enough progesterone.
Why? And like, these are like bombs that are hitting my head. I love this. I got to get the transcript from this and I've got to reread it. With that though, when the progesterone's low, we don't want anybody to have miscarriages, but that's a simple fact that it can happen that way. And I'm trying to divert over here because you made a good point about where the bacteria builds up when you have changes in your cycle. Some patients come in, and I know people have even wrote in on Instagram about they bloat up right when they had their cycle. And that is a big question. Like, oh, right when I have my cycle, my stomach puffs out like I'm pregnant and it gets real puffy. Can you just talk about that a little too?
Yeah, I mean, that can be changes again in our hormones. So maybe what's happening, and it's going to depend, everyone's going to be a little different, but if all of a sudden finally you do have a pretty decent progesterone release, progesterone can cause you to retain water. Yeah, so progesterone can cause you to retain water. I mean, any hormone could technically cause you to retain water in a large amount, but I think a lot of times these girls that have a lot of swelling around their period is, to your point, they have bacterial dysbiosis. So it could be that something's going on with the bacteria or yeast. There's a lot of people out there that have yeast overgrowth, don't even realize it. It could be fluctuations in their bowel. So is it that they're more constipated? I like to ask people that. Well, you say you blow up right around the time of your period. Is that when you also get really constipated? Yes.
Yeah.
Okay, so if we're constipated and we have all this stool in our gut, our body knows that stool's not supposed to sit there. So it starts retaining water into our colon to try to help push our stool out. So a lot of people that blow up and their stomach looks really big, it's because their body's like, I got to get this toxin. I mean, poop is toxin. Like your bowel, your poop, anything that's in your bowel it's full of toxins, y'all. It's stuff that we don't need, we don't want. And so the people who come to me and they're like, I don't have a bowel movement for 2 weeks, I'm just like, I mean, that's disastrous. Like,
Yes.
I mean, so your body knows that. And so a lot of times it's trying to retain water so that it can help try to, push things through. And so there can be a lot of different reasons why people swell right around the time of their period. It can be, fluctuations in hormones. It could be that they're really constipated. Sometimes I also think a thing that we forget about is towards the end of our cycle, a lot of women will tell you they don't sleep well. And if they're not sleeping well because their progesterone is really low, when we don't sleep well, we do not make growth hormone. And when we don't make growth hormone, our insulin levels are much higher. And that causes us to retain water as well. It causes us to, push our food into fat storage instead of burning. And then it does increase our cortisol. So it's all connected.
But can having a UTI in your urinary system, can that in some ways affect your cycle or affect those organs around the bladder, like the ovaries and such, and create any problems?
Yeah. So I see this a lot too. I see a lot more younger girls with either urinary tract infections or just what feels like urinary tract infections at certain parts of their cycle. And and they get treated for a UTI. Interestingly enough, with all of this estrogen dominance or low progesterone, a lot of women, and also PCOS or what's now called PMOS, right? So 1 in about 10 women actually have PCOS or PMOS. We actually think it's closer to 1 in 7. Most women are not diagnosed. There's actually 7 different types of PCOS. And so many women, it takes 10 years to get diagnosed. This was me. They told me I couldn't have PCOS because I was thin. There is an adrenal PCOS. There is a thin PCOS. So there are all these different, and I was in med school. And so guess what? I got the adrenal PCOS picture. But if you have PCOS or your hormones aren't metabolizing correctly, a lot of these young girls now are getting a little bit of endometriosis because they have all this excess.
Oh my goodness.
And endometriosis loves to go to your bladder. And so a lot of times it will set between your bladder and your bowel. And then if you're constipated and your bowel is pushing on your bladder, these girls start getting spasms in their bladder.
Oh
and
my
they
goodness.
have UTIs. And so I see this all the time. They'll come in and we get a UA and I'm like, your urine looks fine. And they're like in tears. They're like, no, something is wrong. And then it's like, okay, well, when's the last time you've gone to the bathroom? Well, I haven't went poop in 3 days. Okay, well, we're constipated. And then if you give them something like pyridium sometimes, or something that will help with bladder spasms, it completely goes away. So they didn't have any. And so this is how I figured it out. They don't have any bacteria in their bladder. They're constipated. You give them something to stop spasms. And I tell them, like, you need to increase your fiber and we need to get you to go to the bathroom. And then as soon as they poop, they're like, it went away. I don't have it anymore. And so it's either that their bowel was so full that it's affecting their bladder and it hurts. And or I really think there's a lot of people out there that have a little bit of endometriosis now because they've had such bad hormone imbalance, right? They've had this bad estrogen circulating and not enough progesterone because their bacteria are out of balance. Because again, our bad bacteria are the ones. So there's a bacteria called calcium D-glucuronidase, or an enzyme called calcium D-glucuronidase that helps us metabolize our hormones. And when we have too much bad bacteria, that calcium D-glucuronidase activity is too high. And then that's what goes and picks all the little holes in the wrapped up estrogen and allows our estrogen to recirculate. And so the higher amount of bad bacteria you have, the higher amount of calcium D-glucuronidase activity you have, then the more this happens. And so I think there's a lot of people out there who have really bad dysbiosis from stress, from, not being breastfed, from whatever, we ended up with these bad guts. And then their hormones aren't metabolizing correctly for years. And some of them end up with little, endometriosis or whatever. And so they start getting all these bladder symptoms. Now, the other thing, to be fair, is if you have low estrogen, that can cause bladder symptoms as well. So,
oh, really? Wow.
Yeah. So we know that when women go through menopause and we lose our estrogen, we have increased risk of UTIs and vaginal dryness. And so if some women have estrogen dominance, but some actually, although they have estrogen dominant symptoms, right? They're all of this bad estrogen that's metabolizing is giving them the symptoms. Their body's not even able to make good estrogen. And the good estrogen is what keeps them from, keeps their skin from being dry, keeps their vagina from being dry, their eyes, etc. And so some people will have those symptoms from having a low estrogen, even though they have high estrogen symptoms, because the high estrogen symptoms are coming from a different type of estrogen.
And so even if the person is doing their best and trying to like make all the corrections, but if that bad estrogen is floating around from the bacterial toxins, that bad estrogen can also lead to weight gain. I had a friend of mine, she's a nurse practitioner here in town, and she's really big about tampons, like organic tampons and like pesticides and stuff, and how that in our cultures also wreaked havoc on like the endometrium and such. Is that something that really has happened into the reproductive system?
I think so. I mean, I think it's true that if you're putting a tampon in that could have endocrine disruptors on it, it can affect, the uterine lining. I think it's a combination of so many things. So we have all these, I think it's almost not fair or malpractice that insurance companies don't allow women to have a Dutch test or some sort of evaluation of how their hormones metabolize at least every couple of years, because we could save women so much. I mean, think about this. You could probably save women from getting breast cancer. This is probably why they don't pay for it, because that's a big business. But if you see on your Dutch test that you're metabolizing all your estrogen down the 4-hydroxy pathway, we've got a problem. And we need to figure out how to metabolize it a different way. Because if we don't, we know that 4-hydroxy estrogen, what it does is at breast tissue, it stimulates the alpha receptors in our breast, not the beta, the alpha. Alpha receptors in our breast increase something called BCL2. BCL2 is literally food for cancer. So if you start to get a mutation in your breast, that is breast cancer, and you have alpha receptor activity because you have too much 4-hydroxy estrogen, the food for the cancer is right there. So you don't want a bunch of 4-hydroxy. You want 2-hydroxy. So if you're making 2-hydroxy estrogen, that stimulates beta receptors in your breast, which are protective. And so, I mean, why wouldn't you allow women to get this test done so that they can see how they're metabolizing their hormones plus their progesterone, and we can see all the pathways, and and you can even do a cycle map where it shows it throughout your entire cycle. And then you can go to these 20-year-old girls. I can show them, like I showed one today. Look, I know this is what's causing your symptoms. You have no progesterone on day 2021 because you're stressed. So now this is how we have to fix it, and then they'll be like, and then if they actually start doing what you tell them, and they eat fiber and they're pooping and they lower their stress, they're like, my periods are so much better. It's like shocking how that happens, right? It's almost a disservice because women, we just don't talk about it. Like women don't know. We're just kind of told, like when I was growing up, right? Like, well, if you have painful periods, that's just part of having painful periods. I got taken to a doctor. The doctor was like, yeah, it's just part of it. Here's birth control. That actually made it worse for 15 years, but I didn't know. And, it's women don't know any better. That's just what we're told.
That is sad. And I am now really thinking about all the patients I've had that if they, like I ask them a lot, are you having a bowel movement every day? And I think about the backup system and how much those toxins can leak out. What do you think about, everybody's different. Everybody can handle foods differently. But does dairy and grains and corn and those things have a pretty hard effect? Or do you see that some of those are hardest on the endocrine system at all?
Here's the thing, and I tell people, don't shoot the messenger, but most people who have inflamed guts, almost everyone, should not be eating gluten or dairy until their gut is in a way better place. And to be honest with you, if you have Hashimoto's and you have a high Hashimoto's antibody, you should not be eating wheat made in this country. Now, if you go to another country where we don't spray our wheat with pesticides and herbicides and everything else, maybe. But when you have a really high TPO antibody, and you're eating wheat, your body will mistake, that wheat that leaves your leaky gut. We make an antibody to it. And that same antibody that is like trying to get that wheat out of your system will attack your thyroid. And so,
oh heavens,
when you have Hashimoto's, you should not be eating gluten. I tell people, if you eat gluten and your stomach hurts, you shouldn't be eating gluten. There's this whole like, do you have celiac? No. But do you have a sensitivity? 100%. Don't eat it. And then same thing with dairy. Dairy is very inflammatory to people who are already inflamed. There's a lot of people who eat dairy and they swear they have no symptoms. Fine. You can see that on a GI. I mean, I do GI maps and you can see whether somebody's having inflammation from dairy in the food that they're eating. But if you are struggling with autoimmune issues, your period's irregular, you're bloating, etc., I tell people, let's get rid of the dairy, let's get rid of the gluten, let's rebuild the lining of our gut, like get rid of, because if you have leaky gut, you have a ton of little holes in your gut. Like, let's rebuild that. Because here's the other interesting thing. If we have a lot of holes in our gut from dairy, from gluten, from stress, we have to rebuild the integrity of our gut, get rid of those holes, because this sounds gross, but there's this mucus layer that lives around the lining of our gut. That mucus layer is where all of our good bacteria live, like Akkermansia and Faecalibacterium and Lactobacillus, the bacteria that we want. If there's little holes everywhere in our gut lining and there's not a good solid mucus layer, our good bacteria just die. So even if you're drinking green smoothies and taking $100 probiotic every month, your probiotic you're just pooping out, because if you don't have a mucin layer and a solid foundation in your gut, your good bacteria have nowhere to live and they die. Now the bad bacteria are kind of like, they're like, I mean, they'll live anywhere. So
Yeah.
you can't really kill them. They're like cockroaches. They're just like, okay, whatever. We'll live wherever in the trenches. But the good bacteria need somewhere to live. And so, yes, if you're eating dairy, gluten, things that are causing that to be worse, we don't really get anywhere. So that's the problem.
That's and this is eye-opening to me, because if the gut layer and the mucus layer gets thinner from all the damage, and there's no place for the bacteria to live, when a person, let's say, as they're healing their gut, this is another question. They realize that I'm making my changes. I am going to heal my gut. I'm going to eat well. They want to have a baby, or they want to get to where they can get pregnant. Is there, okay, this is a lot of questions in one way, but I mean, is there a particular, not say diet, is there a particular way people could eat to get their body healthy, to get the layer thickened, like even some nutrients you recommend, barrier, and then how long do you wait before you try to get pregnant?
So I think the first thing is you remove anything inflammatory, because it doesn't make sense to start adding good stuff if we're still fueling the fire. So we need to remove everything first that's making us inflamed. So that is the ultra processed foods, the sugars, the gluten, the dairy, the wheat. And so I tell people, think about what your grandma, or think about what Jesus ate. Like, single ingredient whole food, right? I mean, like, seriously, my grandma I remember before she died, she'd be like, I know what all this stuff is in the grocery store. Like, what is all this stuff? Like single ingredient whole foods, or foods that you've made by mixing single ingredients together. And so that, I mean, we've got to do that. It's not difficult. Eggs, chicken, beef, vegetables, fruit, sweet potato, and then, so that's one thing, is we've got to remove the stuff that's causing us to have damage. And then we really have to start focusing almost immediately on fiber. And I don't want you to go from eating no fiber to 35 grams. That won't work well, but you need to start incorporating like 5 more grams of fiber into your diet per week, with the goal of getting to 35. And so what does that look like? And so that is from green leafy vegetables. That is from fibrous fruits. Avocado has fiber, flax seeds. By the way, if you're having menstrual issues, especially that girl with the really, really painful breast and the really bad PMS symptoms, ground up flax seed is wonderful for that. And so put some ground up flax seed in your, in whatever I don't care. Put it in water, put it in your coffee, put it somewhere, just drink it, eat it. You could sprinkle it on. I mean, honestly, I put flax seeds on blueberries. But you need to get fiber however you want to get it. And so I have a list in the book too of like, hey, these are some of my favorite fibrous foods, but we've got to start eating fiber. And so those are like 2 of the main things that's got to happen. We've got to get rid of the bad stuff. We've got to start incorporating fiber, so our good bacteria actually have something to eat once and then we have got to just eat single ingredient whole foods. Like it's not difficult. It is, but it isn't, right? Like it is when you're busy, but if you plan, it's not.
One of my friends, she always told me, she said, if you read the ingredient label, the ingredients, if you can't pronounce the name because it has a weird name to it, and you read something and you really can't recognize it, don't eat it, and then just go get a potato or sweet potato or something like that. She always said, just get one thing. And so if you start to heal up, if you got them checked regularly, is there a time when the progesterone level is at a good standing, or the estrogen? What's the level you'd say, okay, now it's time for you can try to get pregnant? Because do you think that women could try to go too fast, like when they've been in a hormone state that's been really deficient.
I think that's a good point too. So, our bodies were made, God made us perfectly. So a lot of these people that are trying to get pregnant and can't, it's because they wouldn't be able to have a baby because their progesterone is out of balance. The tricky part is as you start to get better, yes, you maybe start ovulating and you could potentially get pregnant, but you might not be healthy enough to carry a pregnancy long term. The other thing we forget about is our thyroid. When our progesterone and our estrogen are out of balance when we weren't having normal cycles and now we are, sometimes our thyroid hasn't completely caught up. And so what we have to remember about babies is babies do not have a working thyroid gland for 18 weeks, 0. So from the second you conceive until about 18 weeks, when the baby has a fully functioning thyroid, they're getting 100% of their thyroid hormone from the mom, period.
Wow.
And so if a mom doesn't, so this is why I think a lot of people have miscarriages as well, because if you'll go back and look at their labs, and it's crazy to me because OBs check a TSH and sometimes they don't even check it until 14 weeks. And I'm like, you totally just missed the entire point. Like, what are you going to do at 14 weeks? The baby's brain's already formed. And now the baby is its brain didn't form because you didn't give enough thyroid hormone. But so this is why it's important prior to getting pregnant to know these things, but making sure that the mom has enough thyroid hormone on board. Now, T4 is really important for babies. T3 is really important for mom. So it's not just look at TSH, it's just their T4, is it 1.2 to 1.5 so that the T4 can cross the placenta and the baby can have the thyroid hormone it needs to form and develop until it's 18 weeks. Does the mom have T3 so that her body is, able to function well? And then to your point, is her progesterone, at least 12, hopefully closer to 20 on day like 20, 21, 22 of her cycle? And if not, we know that we need to be watching this so that as soon as she gets pregnant, we can give her progesterone. And so looking at those things, and some people, honestly, Dr. Motley, like I'll have some young girls that they'll come in, they'll get it together in a month or two, their labs look great. And they might get pregnant instantly. Sometimes it takes people 6 months. So I don't know that there's like a timeline you can put on it. I think you should be having, your period should obviously be more regular and they shouldn't be super painful. I think we forget about that too. Like periods were never meant to be this like thing you had to plan your life around. If you're planning your life around your menstrual cycle, something's not right. It was supposed to just kind of happen and then go away. Once that starts to get better, great. And then I think you need to be working with a provider who can look at your labs and tell you, hey, look, it looks like you're safe. And again, it may take a month or two. It may take 6 months. It may take a year if you were on birth control for a long time and you had insulin resistance and your thyroid was bad. I mean, it just depends on what we're trying to fix. But the really cool thing is I see some girls in their 20s that, for lack of a better word, and I mean this so kindly, they are metabolic dumpster fires by the time they get to me. They're just like everything is on fire. And as soon as they fix their diet, they get some fiber in them, they're going to the bathroom, they're sleeping regularly, their stress goes down. They pop right into shape pretty quickly because our bodies were made just perfectly,
What? You are blowing my mind. I love this combo. I am not kidding. I've learned so much. The T4 and the T3 levels of the mother, the weeks that the baby is developing, that blew my mind. Okay. Seriously, guys, I'm thinking my head's reeling right now.
It's important. I'm like, why are we not worried about this? I mean, I don't know. It's just
so crazy.
So many people have miscarriages. Like, why are we not immediately checking a girl's thyroid and her progesterone level the second she knows she's pregnant? Like, it's easy. These are like $2 lab tests, It's not like,
and they don't,
this is, you can check a TSH, a T3, a T4, and a progesterone at Quest Diagnostic for cash for less than $25. You can pay Quest cash, less than $25 for those 4 labs. Why is this just not standard of care from an OB? Like, you call your OB, hey, I'm pregnant. Okay, hey, your labs are in, please go get them. Like, I don't understand.
I don't either. But is there a recommended amount of times you would say you need to get your hormones checked? Like if you're pregnant, like do you say every so many weeks or every so many months in pregnancy? Is there, a repetition in there?
I think it depends on whether, if you're a 20-something-year-old girl, you never had a hormone issue, you get pregnant, probably once is okay, assuming you're not having symptoms or struggling. But if you're a Hashimoto's girl or somebody who's had miscarriages or somebody who's struggled with insulin resistance or PCOS, and or you're having symptoms, then I don't think it's unreasonable to do it at least once a trimester. My girls that have thyroid issues, that I know have thyroid issues and then they get pregnant, they do thyroid labs for me every 4 weeks. They get a standing
Oh
order.
man, that's awesome.
And they go every 4 weeks, and then I just send them a message. This looks good. Let's do this. It's easy. Like, it takes 2 seconds. Why would you not just do it? So every 4 weeks, because now I'm just worried about the baby and I'm worried about them. I don't want them to have any sort of issue,
Oh, okay. Oh man, time is gonna. But one other thing, this is a big question, but those with hormone issues like hair loss, they talk about thyroid. Is there like a hormone level that you say this is what I exactly look for when a lady always has hair loss? Because that's a big thing too.
So hair loss is actually very interesting. A lot of times in women, when they're having hair loss, what I look for are ferritin levels, because ferritin actually, when it's less than 70, won't allow your T3 to work no matter what your level is. So if your T3 is even 4 and it's great, but your ferritin's 15 because you're bleeding really heavy because you have bad PMS symptoms, it doesn't matter. And so you're going to lose your hair, and you're also going to be cold and have restless legs. So ferritin is really important. I like T3 levels to be closer to 4, honestly. But a lot of times with women, especially young women in hair, I talk to them about protein, because if we're not eating enough protein, our hair falls out. And when we're stressed, our hair falls out. Also, when we have big hormone shifts. So if you're having really bad PMS symptoms and your breasts are tender all the time and you're having these huge fluctuations in your hormones, guess what? Your hair is going to fall out. So, so these are things that I tell people, like, let's look at your ferritin, let's look at your thyroid, let's look at your hormones, but then let's start and let's make sure you're eating enough protein, because we could talk about this for an hour, but now everyone takes tirzepatide and semaglutide and whatever tide.
Oh, we got to talk about that. Yeah.
They want to be skinny. And there's a way to do it and there's a place for it. But if you're getting 20 grams of protein a day, your hair is going to fall out. I mean, you need protein and collagen for your hair to form, just like you need thyroid hormone and you need ferritin. So I think that that's one thing people miss a ton. I have a lot of girls who come to me, their hair is falling out in clumps. We get a ferritin, it's 5, 10, 15. And I'm just like, oh my gosh, fix that. It does get better. But also stress and protein.
Stress, being able to poop, seriously, making sure that you keep your cortisol levels moderate and at level. These are some gems.
Sleep. Just sleep. Go to sleep. Just at 10 o'clock. Wake up at 6.
And have a normal sleep cycle as best you can. This has been really good, Doc. I truly am thankful. Please let us know how they can find you on Instagram, on Facebook, wherever you're at. Where can we get to you?
Yeah, thank you. So it's at modern endocrine _. So that's just, you can look up Dr. Cassie Smith, but modern endocrine _ is my handle. And then honestly, you guys, Fix Your Gut, Fix Your Hormones. It's on Amazon. If I would have had this book 15 years ago, I would have paid $10,000 for it. I struggled so long for somebody to try to give me answers and help me. And I wrote it in a way that it could be helpful for patients, but also providers, because we don't learn this in school. This, nobody teaches us this. And so it's on Amazon. If you go to guthormonefix.com and put your information in, I'll give you access to a website. It has so much free stuff on it. It has exactly the labs I get for patients, exactly what levels I want. There's a guide by chapter. So if you go to the PCOS chapter, if you have PCOS, everything you need to win with PCOS. So go to Gut Hormone Fix for that. And the book's going to be ready for Audible within like a week or two, because so many people wanted it to be Audible. It's really long.
Yes.
So I recorded it and I edited it and I did the whole thing. So it's
you
gonna
are
be
a champ.
next week. I know it was a lot.
Seriously, good on you.
We have a website. It's www.modern-endocrine.com, and I have a lot of really good resources there. So
I want everybody out there, if you're having hormone issues, if you know of somebody that has hormone issues, you yourself, get the book, follow Dr. Cassie, get her stuff and check it out. And if, because there's so many people, and people have friends that are having problems getting pregnant. Send them this. And really, I am still thinking about a lot of these points. So I'm really thankful for everybody tuning in today to the podcast. We really appreciate you guys supporting us. If you haven't liked or subscribed, we would really appreciate it. Taking complicated matters and trying to make them simple so you guys can digest them, and so you guys can take this and start practicing them tomorrow. So Dr. Cassie, thank you so much for joining me today. You're a gem. Thank you so much.
For having me, and thank you for doing this. Like, I think it's so important for people to just be the CEO of their own health and to learn, like you said, and just don't take for granted the symptoms that you have, because I did for a really long time. And I feel like symptoms are little gifts from God. Like, hey, pay attention, pay attention. So don't let anyone tell you that it's normal. Like, just find somebody who will listen and take good care of you, because your health is not owned, it's rented, and the rent's due every day.
Oh, that was good. Mic drop. Yep. Okay. Okay, guys. We appreciate everybody out there. And Dr. Smith, from all of us here at the Ancient Health Podcast, have a great day. Before we wrap up, please remember that the information shared in this podcast is for educational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed through this podcast, and the use of information here or materials linked from this podcast is at your own risk. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always consult with your healthcare provider before making any changes to your health regimen, and do not disregard or delay seeking medical advice for any condition you may have. Our content may include sponsorship and affiliate links, to which we earn a small commission on sales made through those links. Thank you for joining us today on the Ancient Health Podcast. We hope you've gained valuable insights into the harmony between Eastern and Western medicine. If you've enjoyed today's episode, be sure to subscribe, share, and leave us a review. Remember, true health is about balance, mind, body, and spirit. So stay tuned for more episodes where we continue to explore how ancient wisdom and modern science can work together to help you thrive. Here's to your health, balance, and well-being. I'm Dr. Chris Motley, and I look forward to our next episode together.